In this presentation, we will discuss Baker's cyst and Achilles tendon rupture and tendinitis. Let's begin talking about Baker's cyst, which is commonly referred to as a popliteal cyst. It's located behind the knee as a result of excess synovial fluid, usually from a weakened joint. This is commonly caused by rheumatoid arthritis. Let's begin by going over a Baker's cyst. A patient usually is asymptomatic, but some may have tenderness behind their knee. Labs associated with a Baker's cyst include rheumatoid factor present in the blood, which is related to rheumatoid arthritis. Patients may have an increased erythrocyte sedimentation rate, which is related to inflammation, and hyperuricemia, which means a high level of uric acid in the blood, normally caused by gout, which can lead to a Baker's cyst as well. For this type of scan, you will use a linear sequential transducer with your patient lying supine, having their leg bent at the knee, angled, and resting on the bed. Be sure to scan in transverse and longitudinal planes and take measurements and color pictures as part of your protocol. A few pitfalls in this scan include patient habitus, which can make the high-frequency transducer hard to penetrate, patient discomfort if they are having tenderness at their knee, and it is an awkward location to scan. Here is an ultrasound image of a Baker's cyst where you can see the well-defined borders filled with anechoic fluid. And this next picture is an example of a complex cyst. As you can see, this internal debris within the Baker's cyst. Two examples of a differential diagnosis for a Baker's cyst include synovial sarcoma and a popliteal artery aneurysm. A synovial sarcoma is actually a malignant tumor of soft tissue around large joints, commonly the knee. It will be slow growing and most often in young adults. And it appears on ultrasound as a hypoechoic mass rather than an anechoic mass that a Baker's cyst will present as. The popliteal artery aneurysm is the most common peripheral aneurysm, and it's more evident in older males. And unlike a Baker's cyst, it'll be bilateral, so it'll be on both the right and the left legs. And it's associated with abdominal aortic aneurysms. MRI can help in diagnosing a Baker's cyst just to help locate the mass using the axial plane here. A Baker's cyst is commonly treated with ice packs, resting, and compression bandages, but in severe cases there will be aspiration and surgical excision, followed by physical therapy. I hope you enjoyed my presentation over Baker's cyst, and we will now be moving on to Achilles tendon and common problems associated with this tendon. The Achilles tendon connects the calf muscle to the posterior heel and is the most commonly injured ankle tendon. I will talk about two conditions, tendinitis, which is the inflammation of the Achilles tendon, and rupture, which is the tear of the tendon. Most commonly, patients will present with posterior ankle pain, and in tendinitis, they will have swelling and a fever. If there's rupture, they will be in significant pain with swelling and edema. The Thompson test is a test to see if there's a complete or partial tear of the tendon. In this test, the patient will be prone and their calf will be squeezed. If the foot plantar flexes, it will be an incomplete tear. And blood labs are usually not used in this type of condition. And like the Baker's cyst, you will also use a linear sequential transducer. You will scan in longitudinal and transverse planes. Be sure to evaluate the entire tendon for tendinitis or rupture, and make sure you scan the right and left ankle just for a comparison. Your patient will be lying prone with their feet hanging off their bed. And a few pitfalls with this type of scan, it is a very superficial location, so you could miss something if you do not use a standoff pad. Patient habitus will also make it difficult. Similar to the Baker's cyst, a high-frequency transducer could have problems penetrating. And if your patient is in severe pain, that could also be a pitfall to the scan. Here is an ultrasound picture of a longitudinal scan. On the left, you can see the normal Achilles tendon and how it should appear on ultrasound. And then on the right, you can see this inflamed tendon. So here the patient has tendinitis. This picture is a longitudinal scan of the Achilles tendon, and here we can see a complete rupture of the Achilles tendon. Two examples of a differential diagnosis include the ruptured Baker cyst, which is accumulated fluid between the deep fascia and the Achilles tendon. It appears as anechoic fluid containing echoes, and this can be confusing compared to a rupture, which also appears anechoic. A retrocalcaneal bursitis is inflammation of the bursa located posterior to the Achilles tendon, and it also appears as a well-defined anechoic fluid posterior to the tendon, which could be confused for a rupture. MRI may be used in conjunction with ultrasound, especially if the results are unclear. MRI does have a higher sensitivity, so it could pick up additional signals within the Achilles that ultrasound may have missed. Tendinitis is usually treated with rest, ice, compression, and elevation, also known as RICE. Some doctors may prescribe medication, physical therapy, or possibly even surgery in severe cases. As for a rupture, a doctor may suggest a cast and let the rupture heal on its own, but most prefer surgery with intense rehabilitation. I hope you enjoyed my presentations over the Baker cyst and Achilles tendon. Thank you for watching.